Hi everyone, I am Mrs. Deepika Sri. Today I am going to talking about the history of tuberculosis. Mr. X, 46 years old male, was apparently normal 2 months ago when he had a persistent productive cough for several months that did not respond to over-the-counter medications. Recently, he has developed a productive cough associated with fatigue, anorexia, night sweats, and weight loss, 5 kg within 2 months. A physician advised the patient to underwent clinical examination that indicates abnormal crackle sound while auscultation. An X-ray showed a small cavity and infiltrates in both lungs. The lab investigation showed that sputum sample and tuberculin test was positive, and the confirmation the diagnosis of active TB. Now we are going to see about how we will manage the patient. It's a small recap of anatomy. The lung are essential organs of respiration. The main function is getting oxygenated, which means it pures oxygenated blood and it removes the carbon dioxide in our body. Air passage, nose, pharynx, larynx, trachea, bronchioles, alveoli. And then it's an introduction, that means defined part. Tuberculosis is one of the most prevalent infection of human beings and contributes considerably to illness and death around the world. It is spread by inhaling droplets of saliva from the cough or sneeze of an infected person. It is slowly spreading chronic granulomatous bacterial infection characterized by gradual weight loss. TB is the world's second most common cause of death from infections after HIV and AIDS. Definition of tuberculosis is the infectious disease primarily affecting the lung parenchyma is most often caused by Mycobacterium tuberculosis. The types of tuberculosis are pulmonary tuberculosis, avian tuberculosis, bovine tuberculosis, and miliary tuberculosis. Incidence, empathy part. Here, men are mostly affected than women, and 1.8 million new TB cases are recorded in early years. The risk factors of TB is close contact of affected person, immunocompromised status, drug abuse and alcoholism, pre-existing conditions, and occupation. Now the assessment. Name the organism which causes the tuberculosis. Mycobacterium tuberculosis. A list of the types of tuberculosis: pulmonary tuberculosis, avian tuberculosis, bovine tuberculosis, and miliary tuberculosis. Mention any two functions of lung. It takes oxygen and it provides to tissues and it removes the carbon dioxide in our tissues. We are going to pathology part. That means pathophysiology. Mycobacterium bacilli inhales a transmitter throughout airway to alveoli. In that it gets multiplied and it transferred to the lymph system and bloodstreams. Now the immune system responds to that action. Phagocytes engulf to many bacteria. The TB bacilli lymphocytes spread in the normal tissue and then it accumulates in an alveoli and it turns bronchopneumonia. And clinical manifestation: anorexia, low-grade fever, night sweats, fatigue, weight loss, unproductive cough, and hemoptysis. Diagnosis of tuberculosis is medical history collection, duration of symptoms, comorbidities, family histories, physical examination, auscultation. Tuberculin test is the main test. We can inject the PPD, that is a purified protein derivatives. If it is more than 10 ml, the result is positive. This is the next ray. So first one is normal XC and second one is infected. That means Mycobacterium tuberculosis occupies these lungs. Treatment and prognosis. TB disease can be treated with an anti-tuberculosis drug of 6 to 9 months of cycle. So first line therapy is streptomycin, isoniazid, rifampicin and pyraneusides and ethambutals. The second stage of drug line is capreomycin, ethanoid, para-aminosalicylic, cycloserine and vitamin B pyridoxine. Third line of drug is rifampicin, clarithromycin, lisinopril and pyridoxine and aggrelin is the third group. And then dots. In dots, directly observed therapy short course, political community, microscopic service, drug supply, surveillance and monitoring system are followed by government and it can help the TB patients to cure the TB. The prevention of TB is isolation, ventilation, cover the mouth, wear the mask, complete the entire course of medication and vaccinations. Thank you.